3.
Good afternoon, everyone. Welcome to today's Facebook Live session. I'm Dr. Keerthana, consultant and fertility specialist at Oasis Fertility, Tolichowki. Today, I'm here to discuss about the most commonly asked queries or the most commonly seen conditions in the gynecopedy, which is about the uterine fibroids, and it's the commonly asked questions: any association of the uterine fibroids with infertility, and how do we tackle it? So to begin with, let's understand in today's session basically what is a fibroid, what is its prevalence, what are the age groups that are commonly affected by the fibroids, risk factors like అంటే ఎలాంటి కండిషన్స్లో రిస్క్ ఎక్కువ ఉంటుంది అండ్ ఎలాంటి కండిషన్స్లో ఫైబ్రాయిడ్స్ వచ్చే అవకాశం తక్కువగా ఉంటుంది ఆర్ కీప్ ఇట్ ఇన్ అదర్ వే వాట్ ఆర్ ద ప్రొటెక్టివ్ ఫ్యాక్టర్స్ అండ్ infertility issues untaya for the women who have fibroids, and what are the mechanisms by which these fibroids cause of fertility, symptomatology anedi ela untundi, what are the changes in the menstruation pattern or the bleeding pattern or the pain pattern that a woman will experience who have fibroids, what a classification, what are the types of fibroids, diagnostic modalities enti, and management gurinchi discuss chestundam. So to start with, fibroids, uterine fibroids, they are also known as myomas. Ante they are the most common tumors in a pelvic tumors in a woman, which are benign in nature. So always remember these fibroids are benign in nature, and they are the tumors of the smooth muscle cells of the uterus. So prevalence గురించి మాట్లాడుకున్నట్టయితే 95% of the affected women with these uterine fibroids are in the age group of 35 to 55 years, and 10% prevalence is seen in the women with infertility, and sole that is in around 3 to 4% of the women, these fibroids are the sole reason for infertility, and it is seen in about 35% of the women with heavy menstrual bleeding. సో ఇప్పుడు రిస్క్ ఫ్యాక్టర్స్ గురించి మాట్లాడుకుంటే increased risk is seen in a woman who is above 40 years of age, or if a woman is nulliparous or having no kids, or a woman with low parity, obese individuals, or the one who have vitamin D3 deficiency, who have this alcohol intake, and who consume more of this beef and red meat. They are one of the risk factors that will keep a woman at increased risk of having these uterine myomas. And in some ethnicities like African descent women, they have an increased risk of having these uterine myomas, and sometimes there is a familial predisposition as well. Protective factors, ఎలాంటి వాళ్ళకి ఫైబ్రాయిడ్ మయోమా రిస్క్ తక్కువగా ఉంటుంది అంటే the woman with increased parity, or a multiparous woman having more than 2 kids, and any woman having her menstruation at start of the menstruation, that is her menarche after the age of 15 or 16 years, that is a girl with late menarche in a later part of life is at decreased risk to have these uterine fibroids. And smoking, use of these birth control pills, and intake of green leafy vegetables and citrus fruits, they are associated with decreased risk of having uterine myomas. Risk factors tarvata ante like infertility, the commonly asked question: do these cause are these a reason for my infertility అని అడుగుతూ ఉంటారు. సో ఇఫ్ యూ ఆర్ కీన్ అంటే ఇన్ఫర్టిలిటీ ఇష్యూ అనేది ఎలా అరైజ్ అవుతుంది ఉమెన్ విత్ ఫైబ్రాయిడ్స్ ఉన్న వాళ్ళలో అంటే దేర్ ఆర్ సమ్ మెకానిజమ్స్, సే లైక్ ఇఫ్ దీస్ ఫైబ్రాయిడ్స్ ఆర్ protruding into the uterine cavity, they sometimes can cause uterine cavity distortion, or they are at the tubal openings, they can cause obstruction of the tubal ostia. సో ఇలా క్యావిటీలోకి ఇంపెండ్ అవుతున్నప్పుడు ట్యూబల్ ఆస్టియా దగ్గర పొజిషన్ అయినప్పుడు దే విల్ సమ్ టైమ్స్ ఇంటర్ఫియర్ విత్ ద or they cause impedance in the sperm and the ovum transport, some thereby leading by these are the physical factors that can cause infertility in a woman with uterine fibroids. Or the other mechanism is by uh, they may sometimes cause what is called as a abnormal uterine contractions because of the excessive chemicals like cytokines and the growth factors as well. And in case of any submucosal fibroids, the place where they are present, usually there will be impaired endometrial receptivity and the gene expression of certain important factors or the genes like HOXA10 and HOXA11, which are usually basically responsible for implantation. So when there is a decreased expression of these important genes or the growth factors that are responsible, there can be a decreased embryo implantation rate, or sometimes because of the impaired blood supply to the endometrium and the myometrium. బ్లడ్ సప్లై తగ్గటం మూలాన కూడా కొన్నిసార్లు ఇన్ఫర్టిలిటీ ఇష్యూస్ అనేవి అరైజ్ అవుతాయి, ఆర్ there can be because of some molecular changes. The changes can be at a molecular level by which they impede the implantation. And clinical presentation or the symptomatology గురించి మాట్లాడుకుంటే more than 50% of these uterine myomas are usually asymptomatic. Symptoms, they depend upon the what do you call the size of the myoma, the number of the myomas, the location, that is where are they present, whether they are within the cavity, whether they are in the wall of the uterus ane దాని మీద డిపెండ్ అయి ఉంటుంది. సో menstruation changes అనేవి they are usually seen in around 35% of the women. Say like what are the changes అని అడిగితే they can be like heavy menstrual bleeding, dysmenorrhea, or there can be irregular intermenstrual bleeding in some women who will have some pedunculated submucosal fibroids. And when they are large, when they are above to 12 to 14 week size, or when they are present in the cervix or in the broad ligament, they can cause some pressure symptoms like urinary frequency, urinary retention, constipation. ఇలాంటి symptomatology కూడా చూస్తుంటాం when these fibroids are located in the cervix or in the broad ligament. And infertility గురించి మాట్లాడుకుంటే, so they are seen in around 10% of the infertile women, and these fibroids are the identifiable cause in around 3 to 4% of the infertile women. That is, they are the sole reason for her infertility. And pregnancy related complications also can occur in some women when a large subserosal fibril has got a pedicle, and it can undergo what is called as a torsion as well, sometimes leading to some pregnancy related complications. Fibroid types గురించి మాట్లాడుకుంటే, they are usually located within the cavity, which we call as a submucosal fibroids, which depending upon the extent of their projection into the uterine cavity can be a type 0, type 1, or type 2 submucosal fibroids. When they are located within the wall of the uterus, వాటిని intramural fibroids అంటాము, which can range from type 3 to type 5. Or when they are into the outer surface, outer wall of the uterus, that is away from the endometrial cavity, and they are projecting into the outer surface, వాటిని subserosal fibroids అని అంటాము, which will project on the uterine surface and which usually range from type 5 or type 6. And after understanding the basic, this classification types, ఎలా డయాగ్నోస్ చేయొచ్చు, డయాగ్నోస్టిక్ మొడాలిటీస్ ఏంటి ఫైబ్రాయిడ్స్ డయాగ్నోస్ చేయడానికి అని అంటే, సబ్మ్యూకోజల్ ఫైబ్రాయిడ్స్ యూజువల్లీ a simple office based 2D or a 3D ultrasound. The transvaginal sonography is the first line modality that has 99% accuracy in diagnosing a uterine fibroids. And 3D ultrasound, though, we can also know about the amount of projection of these submucosal fibroids into the uterine cavity as well. And the other modality is what is called as a hysterosalpingography, in which fibroids like submucosal fibroids, they will be seen as a smooth filling defects inside the uterine cavity. The other modality is by the saline infusion sonography or a 3D saline infusion sonography. They are more useful, or they help in the better detection and delineation of submucosal fibroids. And if these are the non-invasive methods, the minimally invasive method, which is a hysteroscopy, which helps in the direct visualization of the uterine cavity lesions and also help in evaluating the extent of the submucosal fibroids projection into the cavity or the amount that is embedding into the uterine wall as well. And in case of intramural fibroids or the subserosal fibroids, the Office 2D or the 3D transvaginal sonography, the first line diagnostic modality, which is almost 99 to 100% accurate, and higher modalities like MRI is used for the accurate fibroid mapping, like if a woman has got multiple fibroids in her uterus, so to know the number, the size, and how far these fibroids are from the endometrial cavity, usually the place where the implantation usually takes place, how far from the endometrial cavity, how far from the outer surface of the uterus, to know about its vascularity, to know about the secondary changes like degeneration. The higher modalities like MRI can be used for the precise mapping of these fibroids. And the secondary changes, the most important one is to know about the risk of malignant transformation. That is, ఇలాంటి మయోమాస్ ఫ్యూచర్లో క్యాన్సర్ కండిషన్గా కన్వర్ట్ అయ్యే అవకాశం ఉంటుందా, ఆర్ రిస్క్ ఏంటి అని అడుగుతుంటారు. సచ్ రిస్క్ ఇస్ యూజువలీ వెరీ రేర్, విచ్ ఇస్ అబౌట్ 0.2 to 0.5%, which usually occurs in the 6th decade. That is most important. You should always know. And next, management గురించి మాట్లాడుకుంటే, if a woman is asymptomatic, that is, she has uterine myomas but she is asymptomatic, menstruation pattern, bleeding or pain లో ఎలాంటి problems she's not experiencing, or ఎలాంటి symptoms లేకపోయినా, or if a woman is nearing her menopause, these women do not require any treatment. And because more than 50% of them are usually asymptomatic. And individualized treatments are usually there based on the the symptoms, the size, and the site of these fibroids, the location of these fibroids usually. And definitely it is important to know about the age of the female. Fertility status are very important when deciding upon the treatment or deciding upon the therapy for these myomas. And management options are usually medical management or surgical management. So when are these or what are the indications for medical management ane adugutuntaru. So usually it is to have some time to correct the anemia, that is because of the increased blood loss or because of this heavy menstrual bleeding. If a woman lands up in having severe anemia, to correct the anemia and restore her hemoglobin levels before the surgery. That is one of the indication for a medical management. Or to reduce sometimes, the size of a large fibroid, or to decrease the complex surgical procedures and the recovery time. Sometimes medical management is usually attempted to decrease the size of fibroids, or to decrease the complexity of the surgeries. And in a woman nearing menopause, to avoid surgery, sometimes a medical management can be used, or if there is any medical contraindication to surgery. And what are the disadvantages with these medical management? If we talk about these myomas, they may regrow after the cessation of these therapy. So medical therapies anedi, so there are usually two types, like the agents which are used to decrease the myoma volume, decrease the size of the myoma, is one type of medical management. I think the other type is, the woman is symptomatic, she has got heavy menstrual bleeding, she has got severe dysmenorrhea, and because of her heavy menstrual bleeding, she lands up in severe anemia. In such conditions, the first line medicines that come into picture is this simple antifibrinolytic drugs, or simple NSAIDs for her heavy pain in the bleeding, tranexamic acid, the simple antifibrinolytic drug, which is a first line for her heavy menstrual bleeding. And these antifibrinolytics are NSAIDs are usually non-hormonal methods used in the symptomatic women. And the other ways are by using these birth control pills, or if there is no cavity distortion, the uterine cavity shape is all maintained. The ideal method is by using this intrauterine levonorgestrel intrauterine system, which is a reasonable option for a woman who is desiring long-term contraception and for a woman in her perimenopausal age group. And వాల్యూమ్ రిడక్షన్ ఏజెంట్స్ గురించి మాట్లాడుకుంటే the commonly used progestins or the selective progesterone receptor modulators. So these selective progesterone receptor modulators can be given up to a period of about 3 months with a regular monitoring of our liver enzymes, and these can be given to decrease the size of the intramural myomas. And the other ones are the GnRH analogs, are the aromatase inhibitors. So these medicines can be used in women who are not desiring fertility and who are desiring for a decrease in the volume reduction or the size reduction for fibroids. And surgical management, the indications when is a surgical management in a woman with fibroid is required is that when the myoma is larger than 12 to 14 weeks size, that is, she has a large abdominally palpable mass in her pelvis, which is originating from the uterus, the most common uterine tumor, which is about 12 to 14 weeks in size, or it is rapidly growing myoma, or there is a subserosal myoma and it has got a pedicle which is prone to undergo torsion during her postpartum period. So if it is causing any pregnancy complications, that can also be attempted to remove. And if it is likely to complicate a future pregnancy, like I discussed about the torsion, or if there is any doubt about its nature, so surgical management can be usually attempted. And what are the surgical methods? Surgical methods ante it is the myomectomy, that is removal of these myoma along with the pseudo capsule, either in a minimally invasive method like this hysteroscopic myomectomy, laparoscopic myomectomy, robotic myomectomy, or the invasive method, which is the abdominal myomectomies. The other way is if the woman has finished her childbearing period and during her menopause, it's a huge myoma causing heavy menstrual bleeding, which is not controlled medically. And the other method is to undergo what is called as a hysterectomy along with bilateral salpingectomy. And the other minimally invasive methods are the ablative methods like the uterine artery embolization and the magnetic resonance guided focused ultrasound. These are the ablative procedures which will decrease the blood supply to the myoma and cause the avascular necrosis of the myoma. These are the other minimally invasive methods to decrease the myomas, but definitely these are not advised in a woman who are wishing for fertility and a woman who has completed her childbearing during her menopause. These minimally invasive ablative methods can be used in such women. So this is all about uterine fibroids, their relation with infertility, their prevalence, their risk factors, symptomatology, what are the diagnostic modalities that are used, and how do we manage a woman with fibroids. If you have any queries? Can I still conceive naturally if I have uterine fibroids? As I said, it depends upon the number, the size, and the location where the fibroids are there. Intramural fibroids, subserosal fibroids do not cause any problem usually. Submucosal fibroids can have a decreased clinical pregnancy rate. So these submucosal fibroids or any intramural fibroids which have some cavity indentation, such fibroids will need removal. Is there anything can I do to prevent fibroids? Yes, there are some protective factors like, consumption of green vegetables, citrus fruits, birth control pills, being a multiparous woman, having kids, taking good vitamin D3 intake. These are all some of the protective factors which will help naturally a woman not to have fibroids. What are the chances of fibroids recurrence after the treatment? As I said, these medical therapy, once given and once stopped, they might regrow. But with the surgical removal, if there are any seedling ones that are left behind, they can regrow after a surgery as well. There are no further queries. Thank you so much.